Kathleen Martinez is physician assistant at Bronson Orthopedic and joint specialist in South Haven. She works directly with Dr. Mark Nickel, a fellowship-trained and board-certified sports medicine surgeon, providing orthopedic care for individuals in and around the South Haven area. Kathleen, what types of conditions or injuries does an orthopedic provider offer?
We treat any condition related to the musculoskeletal system. So that includes fractures, tendon injuries, ligament injuries, or nerve injuries like carpal tunnel and cubital tunnel, as well as arthritis.
So what kind of patients do you see?
There's a wide variety of patients that we see, anywhere from a 1-year-old with a clavicle fracture or a fracture of a tibia, all the way to a 95-year-old with chronic arthritic disease of their knee or their shoulder. We treat student athletes. We see a lot of student athletes from South Haven, and we treat active individuals as well.
How do you diagnose these conditions?
Typically, you can diagnose an injury based on a physical exam alone, but images such as X-rays, MRIs, CTs, and nerve conduction tests are usually necessary to confirm the diagnosis.
Surgery isn't always necessary. There are non-surgical treatment options, right?
Absolutely. Surgery is usually a last resort. We like to try conservative options before we rely on surgery to treat patients. Those options can include physical therapy, anti-inflammatories, bracing, steroid injections, and viscosupplementation injections, which are gel injections for arthritic disease.
Or should it be necessary, what surgical options are available and when might they be recommended?
We offer shoulder arthroscopies as well as knee arthroscopies. For shoulder arthroscopies, we usually use those for treatments of rotator cuff tears and labral tears, as well as biceps tendonitis. For knee arthroscopies, we usually recommend knee arthroscopies for things like medial meniscal tears, ACL tears, kneecap displacement, or medial patellofemoral ligament tears, which occur when you dislocate your kneecap. And then outside of arthroscopic surgeries, we also offer cubital and carpal tunnel releases and total knees and total shoulder replacement.
Kathleen, talk about recent technological or procedural advancements in orthopedic care that have improved outcomes for patients with knee and shoulder issues.
So I think one of the biggest advancement in orthopedic care has been total knee replacements. They are relatively minimally invasive at this time. We use a Medacta My Knee. So with the Medacta My Knee, we get a 3D representation of your knee before surgery. So our implants are made specifically for your hip, your knee, and your ankle alignment. This allows to cut out approximately an hour of surgical time. So our total operative time for our total knees is about 45 minutes. And that helps with tourniquet time as well. So if surgeries are shorter, you're under a tourniquet, so the blood supply to the leg is cut off for a short amount of time, and that allows healing to be better as well.
How do you help patients feel prepared for surgery, physically, mentally?
I think mentally preparing patients for surgery is just as important as physically preparing them for surgery. Mentally, if you let a patient know what to expect during surgery, after surgery, with physical therapy. Just give them a good idea of what to expect. They're going to recover better, and they're going to be mentally able to recover. Physically, if a patient needs to go through preoperative clearance to make sure their heart and their lungs are strong enough to go forward with a knee or a shoulder replacement, we make sure they see their primary doctor in order to get them ready for a knee or a shoulder replacement. And then if we think a patient would also benefit from physical therapy before surgery, then we place them in what we call prehab. So they can complete physical therapy, get nice and strong before surgery, so they're able to recover better after surgery.
Can you share some insights into the recovery process for individuals undergoing treatment for knee and shoulder pain? What can they expect on the journey?
Yeah, so the recovery process is going to depend on what surgery is completed. So if you have a rotator cuff repair of a shoulder, we typically start physical therapy about a week after surgery with total recovery time around 3 to 4 months. If you have something like a knee arthroscopy or partial meniscectomy where we go in and remove part of the meniscus due to tearing, your recovery is going to be shorter. It's going to be closer to 4 to 6 weeks. So we always do physical therapy following surgery. It just depends what surgery you have and how long you're going to be in physical therapy after surgery.
People want to learn more about anything we've discussed. Where should they go?
You can access Bronson's website on the internet. You can find our orthopedic office, Bronson South Haven, on the internet. So you can go there, or you can stop by our clinic, and we'd be happy to see you there as well.
That website, bronsonhealth.com. Thank you, Kathleen. Kathleen Martinez, physician assistant at Bronson Orthopedic and Joint Specialists in South Haven.